going to do one eye.
Okay.
So
Anterior.
I've got anterior radial selected, so this will be for pachymetry and IOP correction, but we have to have the lights off for this one.
Please look at the center of the green cross and blink freely. Please blink and then keep your eyes open. Thank you. You can blink freely.
So then I double click on the result, top right hand corner. Okay, so I'm just going to change the recognised structure.
And you don't have to put an adapter or anything like that? Or
No.
Anterior eyes, it's all, that's brilliant.
So there's the pachymetry map, there's the stroma map, and up here is IOP correction. So for somebody like me who's got a very average thickness cornea, that makes no difference at all. But somebody who's got a very thick and thin cornea, so you type in your tonometry pressures, let's say it's 27, and it gives you a corrected value, which for me is pretty boring. You know, it hasn't changed much at all.
That's very good.
But if you're doing a referral for high tonometry pressures, a lot of people like to send the output this screen and attach that as the referral. Because you can say, well, yeah, I got high 27 pressures on this patient, but it's possibly because they've got a very thick cornea. And then the hospital look, oh, well, yeah, these guys are
Know what they're talking about.
know what they're talking about, yeah.
What about high minus patients? I mean, it still will take the measurements quite well.
Yeah. I mean, for high myopes and that. So when you're,
Or
that's
high
good.
hypos.
That's a good question actually. When you're in the patient window, so when you add a patient, you have to the fields with the asterisks you have to enter. But if somebody is above or below plus or minus 10, you do put best via power in here.
Okay.
All it means is that if you don't, because when the patient's eye is in situ, the instrument is hunting in a certain axial length position to
Yes.
find the retina to give us an image.
Yeah.
If you get high myope, I'm exaggerating now, but the back of their eye's over here, so the instrument's hunting here,
Yes.
and you're looking at the screen saying it's not erroring,
Yes.
but it's not giving me an image.
Yes.
By then telling the instrument this patient's a minus 10, it says, okay, I won't hunt here for an image,
Sure.
I'll hunt over here for an image, and then give us an image to look at. I think in the manual it says plus or minus 5, but I've never done that. In fact, I've imaged a patient who was minus 10. I forgot to put that value in, and it still found it.
Fine, okay.
But that would be if somebody was sat in front looking at it thinking, I don't have an error message, but I don't have an image to look at. It might be for that reason. Cancel that.
Please place your head on the chin
So then
rest
on,
and blink freely.
If we go to anterior drop down menu to this single B scan, and
Please look at the center of the green cross and blink freely. Please blink and then keep your eyes open. Thank you. You can blink freely.
double click the result.
Oh, that's ace.
So there are measuring tools, so you can measure the angle, but it's very subjective to where you start measuring from, and therefore hence 10 different people would get 10 different angles. Most people just want to see the image, and that's then stored under that patient, and if they scan the patient in a year's time, they can go back and look at that previous image. So if I use the measuring tool, you know, I've got an angle of 38 degrees there, but of course if I change this, you know, I've now got, I know you wouldn't plot it like that, but it's now saying 85 degrees, and clearly that's not 85 degrees.
No.
So most people say, no, most people don't use the measuring tool, they just do the imaging. So I'm just going to get rid of that angle. Close. So if we go back to corner.
Please place your head on the chin rest and blink freely.
So I'm just going to go back to retina again for a moment in results so we can look at progression.
Ah, yes.
So if I choose a retina 3D scan, so because I've been scanned before, progression is highlighted, allowing us to look at it. When you first time you get a patient, that won't be highlighted
No, sure.
because it's got nothing to compare it to. So I click on progression. So it's highlighted retina here, so this is retina progression analysis. So this is what's called the baseline scan. It was the first ever scan done on me on the 28th of Feb last year. And then normally these would be a lot further apart, perhaps on a yearly or 2 yearly time scale. But you can look at the changes, and obviously these values haven't changed a lot. We wouldn't expect them to because it's only done within a year. But the values down here will change colour if there's going to be some significant changes. So the algorithms in the software for regression analysis do what's called post-analysis tracking. So it looks at the vessel structure to make sure that this second area is exactly the same position as the first area, so on and so on. Because if you scan in a slightly different area, then these values are going to be different. So that's retina progression analysis, and then separately you've got ganglion cell layer progression analysis, and then separately again you've got tomogram image only analysis. So I would just line that one up. So if we go back to retina, so the baseline scan, so that's the first year, second, third, fourth, fifth, sixth. When you get to year 7, that baseline scan will stay there. This second scan will drop away. It's not deleted, it just drops away. These scans shove across one, and the scan you do in year 7 will appear here.
Right.
So you're looking at the scan you've just done in comparison to previous year, and original baseline scan.
Fine.
And that should be enough to look at any progressional changes. It's the same with the ganglion cell layer and tomogram. And then that would be similar for disc. So again, so this is left eye, so baseline scan, and then year on, and then any major changes would show us high percentages in the change column. And then you see the map at the bottom here with colour coded for the different dates, so you can see how shape, if it's changing significantly. So if I go back to single eye view, if I go back to acquire.
Please place your head on the chin rest and blink freely.
And then so we go to fundus camera.